Welcome to the Medical Collective, your go-to podcast where medicine meets real life. I'm Dr. Keisha Davis, a pathologist, personal trainer, and your host. I will be joined by a vibrant team of doctors who are not just healthcare professionals, but artists, fitness enthusiasts, and advocates for change. Each episode, we dive deep into the world of medicine, from untold stories of the healthcare industry to the latest in medical advancements. We're here to bring your insights, answer your burning questions, and explore the art and science of healing. So let's get started and step into the world of the Medical Collective. Hello, and welcome to another episode of the Medical Collective with your host, Dr. Keisha Davis. This is another solo episode and a more personal one, if I should say. Today, I'm not speaking as your physician first, but I'm speaking as a patient. I'm speaking with someone that has to deal with, on a daily basis, a chronic disease called migraines. I want you to know that I understand how it is to be a patient, and many doctors do. And I think it's sometimes important for us to get personal and for you to understand our story, and not only our triumphs, but our trials dealing with a chronic illness as a patient who's a physician. Being medically knowledgeable does not protect me from suffering. It may, unfortunately, allow me to understand it better, but sometimes knowing too much can hurt you or harm you. And when you're in the shoe of a patient, you're really just trying to survive. That's truly it. So I want to start by telling you about my migraine story, what they actually look like, and not from a textbook, for many that know that there are different types of headaches, but from real life. So migraines, for those that may have them, I feel your pain. It's hard when you're dealing with a neurological illness because these are things that people don't see. You don't have a bump on your face, right? You don't have a big mass somewhere. You have a chronic illness that no one can understand. Pain is something that people can never fathom. And I think it's hard because those who are going through it, at some point, don't connect with everyone, because people after a while, like, okay, is this pain really real? They start to question you. And then because the pain doesn't have a big flag on it saying it's a 10 out of 10, you're struggling through it kind of by yourself. And you don't always want to take pain medicine. None of that. You just want to be able to feel good so you can live and enjoy life. The migraines cause these headaches that are usually one-sided, right? There's many causes of headaches, by the way. There's different types of headaches that can cause a lot of pain. I'm sure people have heard of cluster headaches, tension headaches, and then there are headaches from actual pathological problems, like if someone has, unfortunately, a tumor, or someone has a vascular disease, they can cause headaches. But the migraines, you want to rule out that nothing else is going on before you're actually diagnosed with a migraine. But they have this clinical story of horrible, bad headaches that are usually like one-sided. You are sensitive to light. You're sensitive to sound. You're nauseated. And sometimes you don't want to get to that point to where you are vomiting, because that actually makes the headache worse. You have auras sometimes, which are stimuli or things that happen before the headache to let you know that it's coming on. I'll talk about that because I used to see prisms. And sometimes you have cognitive slowing, which has happened to me too. And just taking Tylenol never ever works. And some people actually do need more in-depth remedies than over-the-counter medicines. I think it's misunderstood. Sometimes it does take a good neurologist to tell you have migraines. I know also being younger, when I first was diagnosed or knew it, I think I had headaches for quite a few years. First, I wasn't wearing glasses. I didn't know I had a vision problem till 5th grade, which is crazy because I think I was squinting like this the entire part of my childhood. And then when I got glasses, the headaches kind of went away. But then I started working out. a lot going into the heat to run. And I realized, and I thought it was normal, that after I work out, I'm going to have a headache, and it must have been the heat. And I'm out for 3 hours with nausea, light sensitivity, all of those things that make a migraine. And probably not until I was in high school and my mom's like, you probably have migraines, did I put 2 and 2 together that was it. I just took a Tylenol until I knew about Excedrin migraine. And not until I was in college did people start to talk about other medicines you could take, preventative medicines, as well as medicines that could even be taken under your tongue, which we call sublingual, in the midst of the migraine. And sometimes you need both, right? You want something that can prevent them from happening. And then if they do happen, what can you take? As well as you have to look at your whole life to where I remember I was like, okay, I know I have to eat at certain times. I know that certain stimuli or motion that triggers my migraines, I have to avoid a lot of things that people will be like, why can't you do that? And I know that's going to trigger a migraine, so I try to avoid them a lot. I think also if you are a hard worker or you're in a very stressful field, even the people that understand what migraines are, which are other doctors, they really don't, I don't want to say they don't have time for that, but they don't really want to hear what is, quote, the excuse of you have a migraine when you're in the middle of a case, or imagine a surgeon. Or for me, when I have a stack of cases to sign out, but I've got a migraine and I've tried everything. Or you wake up in the middle of the night and you have to work the next day, but the migraine is literally taking you out. It can be difficult, especially when you're dealing with colleagues and things like that. I know that it has definitely made me stronger, and I know many more people are dealing with these migraines. But when you are the doctor and you are still a patient, it is hard to balance that time. You work more. Even though you have sick days, you're not expected to take those sick days off, and you still have to try to keep your head above the water. But it doesn't. There's this pressure that you have to overperform. But what about when you get sick? I remember hearing about many physicians that would have fevers and they still went to work. Or with exceptional pain, and you're still going to work. Like, why? Why are you still going to work with a headache, a fever, or things that normally would put somebody at home? I think that's something we really need to improve, understanding and giving healthcare professionals the same grace that we give other people, because they're not at their best when they're sick. We're not. When I was then for finishing medical school, starting residency up until practice, I felt a lot of guilt. There were times where I was in the midst of maybe even like what we call a frozen section, or the surgeon's waiting for you, or you have a lot of difficult, high-profile cases, cancer cases, and the clock is ticking. You have to leave to get home, because I am a mother, but I had younger kids at the time, and I knew I had a family to go take care of. And you have this thing right behind your head just pounding. And I think for my job, I look in the microscope. So light is directly going into my eyes when I'm looking in the microscope. So what am I supposed to do, right? I have to look in the microscope. I sometimes would have to turn off the light and close the blinds, what have you. And this is literally what I would do. I would take and put my head against the microscope. And just breathe. And for those that believe in God or what have you, for me, I believe in God, I would pray, because the pain would be that intense. And all I would be thinking is about, sometimes it makes me almost cry, is like, I just want this to go. And I'm not thinking about me feeling better. I'm like, I just want the pain to go so I can finish, so I can take care of patient care, so I can sign up the cases. And I would feel bad. People are waiting on me, and I'm dealing with a, quote, headache in the dark for hours, and the cases are coming. And to be honest, the stress makes the headache worse. There was one time it was so bad that I sat at my desk maybe 2 or 3 hours till it was almost dark. And I was scared. It was far away. So I knew my husband technically with the kids, like coming to get me, then a car would be left there. I was like, I'm just going to have to wait it out. And so it was like literally dark. And I'm sitting there because the headache was so bad. Imagine like, I hate to say this, like someone hitting you in the head with a hammer over and over and over again. And my nerves were very sensitive to where I'd start to get tingling. When I had my son, I was holding one time and I lost the vision in my eye. So you sometimes think you're literally having a stroke. I lost the vision in my eye and started to have prisms. And then it was almost like a stroke where I could not speak. So I was trying to call my mom to tell her to come get me, but I couldn't say anything. Yeah, so that's also scary. And as a pathologist, I'm thinking, yeah, I know I have migraines, but maybe this time it's a stroke, or maybe this is something deeper. You know so much in medicine, you start to overdiagnose yourself. I'm like, is this a brain tumor? Like, this has to be something different this time. But I had gotten so much imaging at some point, I'm like, this is just a really bad migraine. There was one time the migraine lasted for 3 weeks. And I was working. And when I'm telling you 3 weeks, I'm not kidding. I was taking so much medicine that I realized that I didn't have a stopping point. It just kept coming. Like there would be 6 hours where I was okay. I called the doctor and she was like, this happens sometimes. It's like a status migraine that's like chronic. And I had to have steroids, and the steroids helped that time. They literally did help. But I felt like I had just been through a big surgery or a big hospitalization. Everything was woozy. And that's another thing people don't understand. After a migraine, you're getting back into reality. Hello, listeners. We want to remind you that you can catch The Medical Collective on all your favorite podcast platforms. That includes Apple, Spotify, and YouTube. Be sure to hit that subscribe button so that you never miss an episode. We're also on Libsyn, and you can find us on all social media platforms as The Medical Collective. Do you have thoughts or questions? Please don't hesitate to reach out. We love hearing from you. Now let's get back to the conversation. You're like, okay, I had the migraine. Now what do I do? I'm trying to get my bearings. I didn't even feel good enough to drive. I was still sensitive to light. It's a lot. And I think that I've come to terms with accepting them. And if people don't understand them or accept them, so be it. Now that I'm doing locums, I've even had one time where the migraine was so bad and I was vomiting. And then on a locums assignment, which is a travel or a contract work where I have a set period of time and that's it, when I'm calling in, they were depending on me. But the migraine was so bad. And this happened one time that I had to cancel. But what was I going to do when I had this? And imagine people going through chemotherapy or other things. They happen. Even with my having to get breast biopsies and workup because I have dense breasts, but I also have a family history, so I'm in a high-risk category. Taking off of that has been difficult. First of all, everybody knows right now what scheduling to get in is hard, even for radiology. And when I had it scheduled and then I actually was covering for somebody for the frozen, I got called and I couldn't leave. And then I'm feeling bad because I needed to go over there. And then I'm sitting there and they find something and they want to do a biopsy. And I'm like, but I got to get back to work. I'm thinking about work. So I imagine it's hard. Our schedules are tight. If we take off, we have a small window of time to do it. And if we're sick, then we're like, oh no, we're cutting into our vacation or time with family. And it's a balance. It is definitely a balance. And imagine if you had to navigate treatment and you are the expert or the patient in that. And one of those stories, I remember not as a treatment, but as my attending when I was on the heme path rotation. So everything that happens in the blood and the lymph nodes and the bone marrow is considered hematopathology. And the hematopathologist at the time developed, I'm serious, while she was working, she had symptoms of acute leukemia and was admitted. And she didn't make it very long. When I went back on rotation, she was off. And I'm looking at a bone marrow of hers. And I'm looking at all the blasts and my heart's just sinking. And I'm like, oh my goodness. So imagine she was working up until the time that she died. She lived her life working as a doctor and then dying as a patient. Yeah. Also with treatment, imagine working and you're dealing with treatment and trying to, sometimes treatment, you get the side effects or you're trying to balance everything. Imagine if you have seizures. There's doctors that have seizures that have other things and they're trying to balance it, or even mood, even have, major depressive disorder, whatever, and they're trying to balance that in the treatment and medication. And a lot of them, you will not even be able to tell that they're dealing with that. So when they come into your office sometimes, think about it, that doctor could be dealing with a serious disease or having a bad day with trial and error. I know with the migraine medicine, it's a trial error. They don't always work the same. And I usually end up stopping taking, especially the medication that's supposed to help me long term because of that. And then the triggers, is the medication going to trigger an episode? And you can imagine all of that. Or is it going to make me nauseated? So you learn patience and you learn to deal with the good days and the bad days. And you learn to be strong because you're coping with a migraine. You're coping with a migraine or you're coping with cancer and you're still working. I know you all heard about one of the breast surgeons who had breast cancer, who still continued going through her end of life, still thinking about patient care. I mean, it's in our heart and our DNA. I know sometimes, even as a parent, we may not be on the best behavior. We may not be glamorous, kind like Snow White, what have you, but we are human beings. And sometimes we're having bad days because we're dealing with disease. We're dealing with illness. We're dealing with the same frustrations you're coming in to the hospital or doctor's office with. Yeah. So I know what I want patients and doctors to understand. For all of us, right? Doctors are patients, and patients are just patients sometimes. So we have to think about that. So they don't understand when we know they don't get it. So when we try to gloss over things, we got to step back. And even though we're saying it over and over again to many patients, those who are clinicians, you got to step back sometimes. I think that's important. So whether you're a patient, whether you're a caregiver, a clinician, listening is so powerful. And I'm a mom, and trust me, I know. Sometimes, even when we're giving them that look while they're talking, are we really listening to them? Because we be giving them that look like, when you finish, I am going to give you a word. We have to think that. Especially, we had an episode before where we talked about technology. Sometimes technology can be at a disadvantage to us when we're relying on it so much, we're not listening anymore. We got all these neat tools and stuff. Okay, they're going to transcribe everything for us. But did we listen to what the patient said? Right? Did you listen to me or your specialist or your consulting physician when they're telling you something about your patient? Are you listening? And patience. Are you listening to the doctor? Because it makes sense when they're saying it, and then when you leave, you forgot everything. I think a lot of that also happens with communication and understanding when there's a barrier is when I go into social media and I hear things like, a doctor did this, or there was something going on now that's really crazy. And I'm like, no doctor even does that. But I think sometimes it can be a lack of listening and communication. So the doctor should be asking, and Dr. Sharon always says she does this. She asks them to kind of say back what she said to see if they understood. And we also need to make sure, or as patients, or me as a patient, that the doctor understands what we're trying to tell them when we're on the other side, right? You've got to have the ability to listen, care, and have empathy. I truly believe pain doesn't have to be visible to be understood. And we know people that are dealing with sickle cell, even those that are doctors. Imagine that, going through a sickle cell crisis and you're not being believed. So patience, we know you're not exaggerating, but if you are, or if you're just seeking attention, just make sure that you are sharing everything you need, because needing mental health care is still necessary care. Even if it's not as bad as you think it could be, a change in symptoms is important for you to share. Clinicians, you have to listen. You have to listen. And everyone, we have to be able to be caring, empathetic, and give grace. Definitely give grace. And believe patients even when they have normal labs. Listen, the pathology, I always say I'm like my dad. My dad is a retired radiologist, but I said we are in the field of diagnostics. So diagnosticians, we say it like it is. Now, what you want to do with that information is up to you. But there are some times where there are changes going on in a person and the labs aren't reflecting that. So that is also something we need to take into account, especially when we're dealing with patients and physicians. And sometimes, even if you know your doctor is not a patient, meaning they don't have a chronic disease or illness, know that those who have kids have been in the same point as you as a parent. And that is the hardest thing. I always thought, like, when my daughter was sick, I would know exactly what to say, right? So I'm making sure they're following it. But my daughter one time had scarlet fever, and they did not listen to me as mom and as pathologist when I said, I think she has strep throat. And she didn't get penicillin in time, and she presented extremely sick with scarlet fever, big swollen face, the red rash, 104, 105 fever, couldn't move, ended up in the ICU. And I really felt like, I don't know if you've ever been in a situation like of surprise or terror when everything you think you knew just goes out the door. You know, people tell you when you're in a situation, you're like, ready, okay, this is what I'm going to do. And it happens and all of that goes out the door. That's what happened when my daughter got sick. There was no doctor besides me telling them or them knowing I was Dr. Keisha because I worked in the medical system. I was literally just mom, holding her, trying to move her head, trying to care for her, just trying to make it through. That's all I was trying to do. That's all. And it is a very humbling experience being a mom and seeing your child sick. And I was working. I was not sleeping. I was sleeping maybe in her chair next to her bed. And then I would have a friend, unless my husband took our son to school, he would come and sit with her. And then I'd walk over to the hospital. And this is also for our colleagues. I did not get any leeway, no time off. Nobody came to see me or my daughter. Nobody sent a card, nothing. We need to be more compassionate with healthcare workers that are A, going through their own illnesses, or B, a family member, a child, a spouse. And I'm no longer there, which is why I'm glad I'm in the situation now. But I think about that, that's very telling too. Make sure you're in a nurturing environment. So a doctor as a patient, imagine if you see how their hospital's so busy and just very stringent, and they're not even thinking about their physicians. That's sometimes also why a lot of doctors are very tired. The employee, unless they're self-employed, and even then it can be busy, but if they don't have a compassionate, caring system, all the system really is worried about is RVUs, which is how many cases or how many patients are being seen, not the quality of care. So if the doctor's sick, at a point, it starts to become actually a problem for them, unless they truly treat their physicians and healthcare workers like family, which I'd love to see more of. Yeah. But back to my migraines. I actually had one this week. but I'm not working. So this one is family stress related. That's another thing I've learned better about breathing. I'm big into working out, but I've also learned to do more of the stillness, the stretching, the breathing, the mindfulness. It helps a lot. But it's also reminded me about compassion. Truly has, especially when I told you about how I was treated when my daughter was sick. But living with migraines has reminded me about compassion. And it matters just as much as clinical expertise. Whether you're a patient, a caregiver, a clinician, listening is powerful medicine. That's good medicine. So I want you all to share your experiences, whether you can in the comment section if you're listening on YouTube or on our social media, or also on the medical-collective.net, medical-collective.net and .com. You can share on the tab at the top a voice note about your experiences. Encourage patients as well, you as patients, to advocate for yourself. And maybe sometimes talk to your doctor too. Support them, understand. I did a space during the pandemic, and it was called The Frontliners on social media. And doctors would come up who were dealing with difficult times, struggling, some of them almost in tears, crying at the hospital because it was new for all of us. And patients came up after and said, you know what? I really appreciate this space because we're hearing what doctors go through. The next time my physician comes into the office, I'm going to put things into different perspective. And now I see why they are the way they are. Yes. Physicians, I also encourage you all, my colleagues, to slow down and listen if you can, and make sure you're taking care of your health, especially if you're dealing with a chronic disease or illness. Doctors need to care, but they also need care. So you make sure you're caring for yourself first. I want to thank all of you all for being here today. Take care of yourselves, take care of others, and thank a person today. Until next time. Thank you for tuning in to the Medical Collective. We hope today's episode has left you with valuable insights and a new perspective on healthcare. Don't forget, follow us on social media for more updates and behind-the-scenes content. I'm Dr. Keisha Davis, and it's been a pleasure to share this time with you. Stay healthy, stay informed, and we'll see you in the next episode, where medicine continues to meet real life. Please note that the content provided in the Medical Collective podcast, including text, graphics, images, and other material, is for informational purposes only. The content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. The views and opinions expressed on this podcast are solely those of the individual authors and guests and do not represent those of the Medical Collective, its staff, and any affiliated entities. The appearance of content on the podcast does not imply an endorsement. Neither the host, Dr. Keisha Davis, the co-host, or any guest of the podcast bear responsibility for the accuracy of the content provided or the use of information received through the podcast. Reliance on any information provided by the Medical Collective podcast, its employees, writers, or guests is solely at your own risk.